Good day, listeners. Welcome to today's episode of our Deep Dive podcast, where we explore pivotal developments shaping our world. Today, we turn our focus to a significant and controversial decision made by the United States government, the withdrawal from the World Health Organization, or WHO, effective immediately. This move marks a critical juncture in both global health governance and international relations, with profound implications on multiple fronts. The United States has been a key player in the World Health Organization since its inception in 1948. As one of the largest contributors to the organization, both financially and in terms of resources, the U.S. has played a substantial role in shaping global health policies and initiatives. The decision to withdraw from this international body, therefore, raises important questions about the future of global health cooperation and the United States' role on the world stage. To understand the gravity of this decision, we must first consider the historical context and the raison d'etre of the WHO. Founded after the Second World War, the WHO was established to coordinate international health within the United Nations system, with the fundamental aim of promoting and protecting global health. Its contributions include eradicating smallpox, combating the spread of HIV, and responding to health emergencies, such as the Ebola outbreak in West Africa, and more recently, the COVID-19 pandemic. Over the years, however, the organization has faced criticism regarding its ability to respond swiftly and effectively to global health crises. Some critics have argued that the WHO's bureaucratic structure hinders its responsiveness and that political influences from member states can compromise its decision-making processes. It is within this context of ongoing scrutiny that the United States' decision emerges, reflecting deeper tensions over the organization's performance and governance. From a political perspective, the decision to withdraw can be seen as part of a broader trend of U.S. retrenchment from international institutions and multilateral agreements. It signals a shift towards a more unilateral approach to international relations, where the emphasis is placed on prioritizing domestic interests over global cooperation. This approach has its proponents, who argue that it allows for more focused and effective use of national resources. However, it also raises concerns about the erosion of multilateralism and the potential for increased global instability as cooperation on transnational issues becomes more fragmented. The immediate impact of the U.S. withdrawal will likely be felt in the realm of global health funding. The United States has been one of the largest financial contributors to the WHO, accounting for a significant portion of its budget. This funding supports a wide array of programs, from vaccine distribution to disease surveillance and emergency response efforts. The absence of U.S. contributions could lead to funding shortfalls, potentially hampering the WHO's ability to carry out its mission effectively, particularly in low and middle-income countries that rely heavily on international support for their health systems. Furthermore, this withdrawal could set a precedent for other nations to reconsider their commitments to the WHO, especially at a time when global health security is paramount. The challenges posed by pandemics, climate change, and increasing antimicrobial resistance require coordinated international responses. The weakening of the WHO's authority and resources could compromise its capacity to lead and coordinate such efforts, ultimately affecting the health and well-being of populations worldwide. In contemplating the broader implications, it is crucial to consider the intersection of health and global politics. The COVID-19 pandemic underscored the interconnectedness of the world and the necessity of a cohesive global health response. The virus knows no borders, and its effective management depends on information sharing, collaboration, and support across nations. The U.S. decision to step away from the WHO could complicate international collaboration mechanisms, making it more challenging to address future health emergencies swiftly and cohesively. As we navigate these complex developments, it is vital to ponder what this means for the future. Will the U.S. engage in alternative forms of global health collaboration outside the framework of the WHO? How will this decision affect the strategic alliances the U.S. has built over decades in the realm of global health? These are questions that policymakers and stakeholders will need to address in the coming weeks and months. In closing, the United States' withdrawal from the World Health Organization represents a critical turning point in global health governance. While the decision reflects legitimate concerns regarding the WHO's effectiveness and governance, it also poses significant challenges for international cooperation in an era where global health threats require collective action more than ever. As we move forward, the importance of dialogue, collaboration, and sustained commitment to addressing shared health challenges remains paramount. The path ahead is uncertain, but what remains clear is the necessity for continued engagement and the pursuit of solutions that benefit the global community as a whole. Thank you for joining us today. Until next time, stay informed and stay engaged.